PTSD and TBI share a lot of common symptoms. There's a very faint nosological or diagnostic boundary between the two, and often they're treated separately, and so they can be confounding and create confusion in the person with them. And I guess the first thing I would say is that these wounds in general, because they're difficult to decipher and they're invisible, are different than a physical injury. When somebody has a physical injury with a TBI and there's intracranial involvement, I say this carefully, it's obvious, and so their very appearance sort of rallies support to them. So if they have an amputation, not that I would trade places with that individual, but they are viewed as somebody who's probably also sustained a TBI and probably has some kind of post-traumatic stress response, and they're given a lot of social, emotional, and medical support, rightfully so. But when these wounds are invisibles, and if you will, your gray cells get mushed together and your marbles get rolled around, it's very hard to describe, and it's very hard to know what's going on, and you may not even know what's happening to you. And so warriors know now that these are signature injuries of the war, that we've done a lot to reduce stigma. But what we've done at Fort Belvoir is we've tried to integrate the services together to address them simultaneously. And that way the warrior doesn't feel confused, well, why didn't they address my TBI or PTSD? And because they share symptoms, what we typically like to do is rule out the psychological symptoms first. And part of that is also because sometimes when you wait with TBI, the symptoms abate a little bit. And so we also want to educate them about those symptoms. So some of the shared symptoms are the emotional dysregulation. It might manifest itself as anger or outbursts, impulsivity. There's a certain degree of anxiety that comes with these changes in behaviors. So PTSD is really an anxiety disorder, with some other unique features to it. But when you have a change in functioning, it's also anxiety producing on top of what might have actually caused the initial injury. And so those two things become confusing. And then with that, those symptoms, there's a certain degree of masking your previous performance levels. And so often there's an assumption that there's a traumatic brain injury because my cognitive functioning or my ability to concentrate, for example, isn't quite the same. And then as a result of that anxiety or that hypervigilance that they both share, there's often also sleeplessness, which makes those symptoms worse as well. And so we try to figure out whether it's organic or whether it's psychological. Now, if we know there's been a physical injury, then we often will, target right away the neurological symptoms associated with TBI. But if there hasn't been some kind of documented or pretty credible report that that's happened, then we might target the psychological symptoms first.